In today's video, we'll discuss the differences and similarities between nurse practitioners and physician's assistants in order to give you a better understanding of the two roles. If you're new here, welcome, I'm Liz. I'm a family nurse practitioner, but I'm just gonna make it clear from the get-go, I'm also a huge fan of PAs. I find it absolutely ridiculous how much I'm so much better than you there is out there between on the whole topic. So if you came here looking for a self-righteous video about how nurse practitioners are better than every other human on the entire planet, you would be totally right, but that's not what this video is about. Just kidding. Just kidding, friends, calm down. All right, so let's start looking at PAs and NPs and how they're similar, because they're similar in a lot of ways, and we tend to forget that. Both are advanced practice healthcare providers who assess, diagnose, and treat patients. So they can both write orders, medications, tests, imaging. They can both work in all sorts of different settings. But most importantly, they both provide safe and competent care, and they are both minimally master's prepared. Next question, do they need physician oversight? In 21 states plus Washington, D.C., as of right now, 2019, nurse practitioners can practice independently without physician oversight. In the rest of the states, nurse practitioners do need physician oversight in order to practice. Right now, as it stands, physician's assistants always need physician oversight. But I'm willing to bet in the coming years, a lot of that is going to change. I think PAs might be able to practice independently. I think nurse practitioners I know are trying to practice more independently. So a lot of that's up in the air and changing. But even with physician collaboration, it's not like they're sitting there hanging over your shoulder, guys. There's a lot of independence in both of the roles. So I don't want that to cloud your judgment and feel like, oh my gosh, it's like you're being babysat. It's really not like that at all. It's kind of like a second set of eyes in case you need them, which can be nice. What is the training like for these professions? Like I said earlier, both are minimally a master's degree. Current NP programs are kind of split between being a Master's of Science in Nursing and a Doctorate of Nursing practice. The switch in nurse practitioners is kind of going towards doctorates, and the hope by the higher ups is that by 2023, all programs will be doctorates, but they've been saying that for a long time. So basically, nurse practitioners at this moment can be either a master's or a doctorate. Like many things, this will probably change in a few years. The majority of PA programs right now are master's programs, but I was doing some research and they are coming out with some doctorate programs for the PA role. So I think that might be an evolving thing as well right now. Like I said, ever changing. All of it's kind of up in the air, but mostly masters for PAs can be doctorates. NP programs are typically 2 years full-time and 3 years part-time for your masters. Add another year for if you're getting your doctorate. PA programs typically run 25 to 26-ish months, and you do not have the part-time option. Nurse practitioner programs are specialized to target a specific patient population and setting. So inpatient, outpatient, adult, kid, all. So examples are family nurse practitioners, women's health nurse practitioners, pediatric acute care nurse practitioners. All your education goes towards that specific patient population in that setting, inpatient, outpatient, whatever it is. PA programs are aimed at a much more general approach. Much like med school, you learn all areas of medicine and spend time rotating through clinical in every little subdivision: surgery, women's health, infectious disease, trauma, ER. You kind of get a little bit of everything. Inpatient, outpatient, all the goodies. All right, so in terms of school, how many clinical hours are done in each program? Depending on the program, NP school has between 550 to 1,500 clinical hours. Programs like acute care, family nurse practitioner, doctorates, those are gonna have a little bit more than like primary peds, all of that. Also, I just wanna make note that nurse practitioners are registered nurses, so many have years and years of experience prior to entering this role. So while it's not really like clinical hours in the sense that you're in a provider role, a lot of nurse practitioners have a lot of healthcare background that they're bringing to the table, as well as obviously those clinical hours, which I think those hours are just helpful in general. All that experience, I mean, it counts for a lot. I am biased at least because I think my years of healthcare experience as a nurse were super helpful to me as an NP. Now, PA school has about 2,000 hours of clinical amongst all the different specialties that they get to rotate through. And here, I just want to note too that a lot of PAs have at least like 1,000 hours of patient contact hours before they go to PA school as a requirement to get into PA school. So they've been MAs, they've been techs, some of them have been nurses, and all of that experience is super valuable as well. So while those numbers might not seem gigantic, you have a lot of other experiences going into these degrees. So let's take a minute and look at the education and how it's different. Nursing school, NP school, All of that is based on the nursing model, which is supposed to be more about like the holistic patient care, looking at the whole patient, the socioeconomic status, the culture, all of that, and how it affects the person and why they make the decisions they do, how it affects their medical care, and kind of incorporate it all to guide them to wellness. And the medical model historically has been highly disease focused, looking solely at the disease, what's going on with pathophysiology, anatomy, and not necessarily looking at the human as a whole. Fortunately, in case you can't tell by how I've been describing it, I've found that in the nursing model and the medical model and how we learn both have been kind of meeting in the middle. They've been learning from each other, taking away the awesome parts that both come with and kind of meshing a little bit. My NP school definitely emphasized looking at the person as the whole, what community they live in, what is going on with this person in general before approaching a treatment, but they equally emphasized evidence-based medicine intervention treatments. In my training consisted of extensive courses in pathophysiology, anatomy, pharmacology, all of the sciences that are also present in a medical model. And similarly, med school and PA school emphasize looking at the whole human being as well and taking, their mental health, their physical health, all of that wrapped into the whole package, while combining that with their extensive knowledge of anatomy, physiology, looking at the detailed what is going on at the cellular level with this disease to help find a treatment. I think we like a lot of the times to throw out the term like medical model and nursing model when deciding, ooh, NP school or PA school, but really guys, I found the two to be meshing a lot, and I'm honestly thrilled. One difference that there definitely is that in PA school, you do all of your didactic, which is like your in-class bookwork learning in the first year of your program, and then in your second, you rotate through all of your clinical. Whereas in nurse practitioner school, it's a little bit more interspersed. So you have like one semester in the beginning that's just bookwork, and then you slowly start your clinical, and obviously the hours ramp up and are more content and are more hour loaded at the end of the program, but you do kind of scatter them all throughout. And PA school is always pretty much in person full-time, whereas NP school can be online. There's hybrid programs, there's in-person programs, and it's part-time, full-time. It has a little bit more flexibility there. Can both nurse practitioners and PAs work in specialties? Yes, with the exception of the OR, which seems pretty much to be in the niche of physician's assistants since they actually rotate through and do a surgery rotation in school. Pretty much all the other specialties are up for grabs, and both NPs and PAs can work in them. What about procedures? Both NPs and PAs can perform procedures. You just need to go through the proper training and have the certificate or whatever saying, yes, you know how to do this, you've done the course, you've done it, you're good. PAs do tend to learn a larger number of skills in terms of procedures, but may not do quite as many of a certain type as nurse practitioners will do in their programs. I'll give you an example. When I was in NP school, I had one clinical where there was also a PA student there working kind of alongside with us. And we were kind of at the same point in our programs respectively. I was much more comfortable than she was doing like INDs, PAPs, nerve blocks than she was, because in my training, primary care, I saw that all the time. So I've done a lot of them. However, she had placed central lines, chest tubes, had a lot more experience with like suturing through her time in the ER, and was much better at those things than me because of her large variety of experiences. But you can absolutely, as an NP or PA, learn procedures. You have that ability. Go for it. You have like all sorts of workshops and all sorts of cool things that you can do in order to gain some of those skills if you'd like them. And that, my friends, is the basic rundown between nurse practitioners and physician's assistants. Both are seriously wonderful options, and I look forward to the day that we can realize that as a community and maybe get along a little better. Not to say all NPs and PAs don't get along, but there just seems to be a little like, I'm better than you, Now that's all wrapped up. Again, if you're new here, I'm Liz. I'm a family nurse practitioner, and on this channel, I make videos about all things nursing and P school, tech, and PA related too. I also have a weekly vlog where I share my life just as an NP, and you kind of get to see what the day-to-day looks like while wrangling a toddler and chasing after a dog. So if that sounds like a good time to you, consider subscribing for more videos just like this one. I would love to have you. And head over to Instagram where I post fun tidbits about what I see in clinic and things I'm learning as I go along the way. Question of the day. What specialty area would you want to work in as an NP or a PA? Or I guess a whatever. I work in family medicine and I absolutely love it. And if I was gonna do anything else, it would probably be pediatric cardiology, because that is where my background is, and it stole my heart. Get it? But really, those are both wonderful, but there's so many awesome specialties out there, and I'm excited to hear which one excites you, because it makes me so happy that some people love feet. Like podiatry people, wonderful. So happy for you. thank you, I'm glad you exist. All right guys, hope you have a phenomenal week. And if you're looking for some other videos to watch, make sure to check out my one on family nurse practitioners, talking all about what we do, how I got here, all that good stuff. And make sure you're subscribed because next week we'll go over how I eventually came to the decision FNP over PA. All right guys, have a fabulous rest of your day and I'll see you later. Bye.